Hello everyone, welcome to our webinars on using data science to analyze Open Canada data, specifically the data which relates to vaccines. This is the data which is of highest interest right now to many people, even those who have opposite opinions about the efficacy and the safety. And with the data, we hope to bridge the divide between those two populations in our country, because data is just the data, and we try to use data science techniques to make it more understandable. We build tools to visualize the data, to track the data over time. So as usually, I would use, I will start sharing my screen, and we'll just go through the latest results which have been published this week by the Public Health Agency of Canada. Okay, so I'm sharing the screen right now. And in meanwhile, please go everyone to the website ivim.ca. Right? So IVIM stands for Independently Verified Information Machine. Essentially, the idea is to automate the process of visualizing and validating the data. Now, you should be able to see the screen right now. Please put your thumbs up so that I know you can see my screen. Because we will start. Now, also, as usual, we have a chat window, and I'm monitoring the chat window at the same time. So if there are any questions, you can type your questions right here. Also, this video will be posted on YouTube and also will be discussed on Twitter, and you could pose your questions there as well. So much has been done since last 2 weeks when we talked about the latest Agency of Canada, and we have rearranged entirely the dashboard, which is on ivim.ca website. Now, as you will go there, you would see really a collection of time series data. Time series is very important piece of information. In fact, in data analysis, time series probably is the most important piece of evidence you could have. Ideally, you should never just report the aggregates or the averages of any statistic, of any measurement. You do need to see how the measurement, whatever measurement it is, changes over time, whether it goes up, whether it goes down, and then you can take the average of it, you can put a trend line, and you understand what's going on, the life behind the numbers, right? So this is what we're trying to do here. We're trying to track all those different metric statistics over time. And that's exactly what the portal shows right now. Now, you remember we have the page which lists all the data sources. I suggest we open this page at the same time, data sources and spreadsheet. And it shows you again the official Government of Canada data sources which we're using. They're listed right here. This is COVID Daily Epidemiology Update, which is published weekly. And once a week, they provide update also on cases following vaccination, which is very important because this is the only piece of evidence we have from post-marketing, meaning after the vaccines have been already used, not before they were used or tested in the lab somewhere, right? So, and also in the same page, there is statistics related to variation by age. So people dying from COVID, what is the age? What is the average age of people who are dying from COVID? And we will open this web sheet, or this page, sorry, and you see I have already opened it on the screen. It's right. And as always, we will just go one by one to all those tables and see what is happening there, right? Now, the other piece of information or source which we are analyzing relates to reported side effects following COVID vaccination. Now, today we will not have time to talk about that, but again, the link is right there, and the data from this source is also visualized on the dashboard. In fact, that's the first graph which you would see here. It's taken exactly from this report on side effects. Okay, and we will go one by one to all those graphs. Now, we have added a few more references, which we are not using yet, but we would like to use them as well. In fact, last time during our last seminar, 2 weeks ago, one of the comments we have received from the audience was, can we correlate Canadian data with data coming from other countries, let's say from UK or from New Zealand? Indeed, very, very good point, because, for example, in Canada, they do not report vaccination data cases by vaccination divided into age groups, whereas in UK, they do provide this information. And that's why we have included UK data right here as well. And I have the file already opened on the screen. So this is the file from official UK data, which is shown right now here, which is called Vaccine Weekly Surveillance Reports. And we have cached those reports as well and copied them on our local IVIM.ca website. And one of those right there. And you would see a table which is very similar to the table which we have analyzed from Canada. It shows the number of cases in just cases, then cases presenting to emergency care, table 11, then table 12, COVID deaths within 28 days and within 60 days of being tested positive, divided by, very importantly, by this vaccination status. And you see, not vaccinated, then receiving 1 dose, receiving 2 doses, and 3 doses, but also categorized by age, you see? So this is very, very important. In Canada, they do not provide categorization by age. They just put all the statistics together. And that's why we're going now back into our Canadian daily epidemiology update, and we click on this link, case following vaccination. It's table number 2, and it is shown right now on your screen. You see, this is the table, really. Canadian table is much smaller than the table from United Kingdom, but it still shows very useful information for unvaccinated versus fully vaccinated and fully vaccinated with additional dose. And you see how many deaths have happened in each of those categories, right? And you remember that what we do then, we would just take this data exactly as this type here, and we move it or we copy it into our spreadsheet, which is shown right now on your screen. It's the last line, which is shown right now, right here. So we just cut and paste all of the data from official website so that we can see how those numbers change over time, right? And for example, you see that the percentage of fully vaccinated divided by total has increased from 27.9 to 28.4. Let's just check. That's exactly the number which is shown right now in here. 17.5 plus 10.9 gives you exactly the percentage which is shown here. And then you can see how this percentage is growing with every week from the very first week when this data has become available. And we plot it now here, and we even put a trend line here. So it just goes steadily, increasingly, monotonically up, right? And we know why. Remember, we talked about that many, many times, that they count the cases before they were actually fully vaccinated in Canada. Okay, so we can now go back to our report. And if there are any questions, please don't hesitate to interrupt me. and I'm monitoring my chat here. So what do we see here? First, we show weekly, again, very importantly, weekly, the dynamics of severe adverse reactions by age group, because this source does provide information for 3 categories, from 5 to 11, from 12 to 17, and then for everyone else. Now, you would see we have added a thick yellow line, which we call projected, based on the reporting delay. So what it is, green line is the actual number which is reported. Let's say right now, the last one, it's 45. So in the last week, or the week of 25th of March, there were 45 serious events reported. But when we look projected, it will be more than 45. It's 135. So where this number comes from? It's using technique, very simple machine learning technique, which learns from historical data. You just need to look into the report back in May, and then into the report 6 months later, let's say, and compare the numbers which are reported for the same month, for the same months of May, by 2 reports. The numbers reported back in May or in June and reported now. And you would see that indeed it takes, for majority, over the half of cases, it takes about 3-4 months to report those events. So we understand that everything which is reported now, it's not yet the final number for the month or for the week of April or March. These numbers will keep growing, and in fact, in about 3-4 weeks, we expect them just to go from 45 to 135, just based on the historical data. Now, what are these serious adverse reactions? Many people may not understand, in fact, how serious they are. So these are life-threatening reactions or events. And it's very important to visualize them as well. How do they change over time? And that's why we added another plot here, which shows all of those major severe adverse reactions. That includes heart failures, liver failures, anaphylaxis, which is a very strong reaction of the body to the vaccine. So, and you can see how this changes over time. Now, a comment here is that we're using logarithmic scale here. So just that you have to be aware of that in order to show you the small numbers, because the numbers for children, for example, is quite small compared to the overall number of events. But it's still, it is there, and it's more than number of deaths from COVID for the same population. So we show this in the following graph. So it shows cases deceased by age group. And you would see that for the age from 0 to 12, actually we have zeros for the entire duration since at least June. There was 1 reported there. So again, it takes a little bit of understanding to better figure out how these plots are visualizing the data. But essentially, if it's less than 1, it shows you that it's 0, or it's in average, it's less than 1. Okay, now for the other statistics, which is the most important statistics, which is how many deceased have happened between fully vaccinated versus unvaccinated. So these are the weekly numbers which are obtained from the source file, and you see weekly average is shown on the vertical line. And so these are the numbers. So these are total blue lines, and then you see different lines here for 0 doses, 1 doses, and other a number of doses. So very importantly, if we recompute these for the for each population, because this is where you would know the effect of the vaccine in reducing the risk of dying from COVID. And you would see that red bars here, which are showing the number of deaths among unvaccinated doses, is higher than the average. So it means that 0 doses are dying more likely, and 1 dose or other doses less likely. But then you would like to compare, okay, by how much? And this is called the odds. So, and you can compute the odds, and we show it right here. The odds of dying of COVID if you have 0 doses versus 1 dose. So again, it's a logarithmic scale which shows you whether the odds of dying is higher or lower for a particular population. So let's understand what this table is showing us. So for cases deceased by vaccination status, it shows you that the red bar is actually, especially in the beginning in June, it was about actually 13, 12 times more likely to die of COVID, or I do not say of COVID, we say cases deceased, because that's how they're called in Canada, because it could be of COVID, or it could be with COVID, or it could be combined with other health problems, and maybe COVID triggered some of those other problems, or maybe it was just another cause in addition to the other causes. So, and you see that the red bar then goes down, so it reduces. It means that the risk of dying for unvaccinated becomes less. So, and actually, as of now, in on 4th of, actually it's 3rd of April, we see that for the red line, it's only 1.91. So it's twice more likely or more risky to die with COVID or of COVID if you are unvaccinated. You see, so it goes with time, it reduces. Okay, that's good to know. Similarly, you can look at the effect of the 3rd vaccine, the booster. The booster here is shown as a orange, this orange line here. And you would see it's a comparison of being vaccinated with 1 dose versus 3 doses. And you see it's lower than 1. It means that the risk of dying of 3 doses or with 3 doses is actually more. So it's about 10 times more, and here it's about 0.17. So, but it shows you, so what this number shows you, it's a risk of dying with 1 dose is less by a factor of 0.17 compared to people who have 3 doses. So you see, this is a very interesting dynamic. In the beginning, this orange, you see in the beginning, when you look at it, it was above 1, right? When you compare even to 0 doses. So 0 doses is yellow. You see, it's above 1. It's it shows you that the risk with 3 doses is 2.54 less than 0 doses. But then it goes down, 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 and eventually it becomes less than 1. So the 3rd dose seems like it is not as efficient after several weeks as it was in the beginning. Okay, so that's how these graphs are plotted, and indeed they show you the dynamics of different parameters over time. Now let's see what else we have here. We also have this visual 1 graph which shows the average since 1st of February. And this graph is probably the most succinct way of describing this phenomenon which we have just observed. It shows exactly what we have just discussed, that the highest risk of COVID deaths is for people with 0 doses. Then, and you can compare it, right? So 0 dose versus 1 dose, it's 2.9. Then it becomes not as, the difference is not as much when you compare 0 doses to fully vaccinated, and even less when you compare it to 3 doses. But eventually, what is most important here to observe is that 1 dose is actually less risky than 2 doses and less risky than 3 doses. So that's what we observe in here. Another interesting graph is here is the percentage of complications among COVID cases by vaccination status. So if you already have a COVID case, if you're infected with COVID, what is the chance of you dying, right? So, and this is shown in this graph. So you would see that for 0 doses, it remains about the same, about 1.1% from all the time, pretty much, and just slightly less since January, 1%. So there is only 1% of all COVID cases which are dying when you look at the population of unvaccinated. Now let's see what happens with people who have been fully vaccinated, meaning 2+ doses. So you see in the beginning, there was a high percentage of them dying, right? And then it reduces over time. Now, again, we cannot conclude anything specific about the efficacy of vaccine, because vaccines are administered to a particular category of population which is most susceptible to COVID. So that's why you would, in fact, you cannot compare apples to oranges, as they say, because indeed it's people who are elderly, who have other health problems, who are administered the vaccine, and vaccine is helping them, but they are still dying, right? But if you are healthy, if you don't have other health problems, indeed it's very stable. You see that it's about 1% of people who are diagnosed with COVID and then dying with COVID or of COVID. Okay, so this is pretty much what we wanted to show you today. Now, if you would have any questions, we could talk about those issues separately. But now I'll just go through the list of questions which we have received last time. And one of them was specifically about the definition of deaths. So we have created frequently asked questions on our seminar page, and I will go there right away. You can do it with me at the same time. And this is where we are posting slides, recordings of these seminars, and we have also added now frequently asked questions here. And one of them is, okay, COVID deaths, how they are defined. And we found that in Canada, they're defined differently from the way they're defined in United Kingdom. So in United Kingdom, the Office of National Statistics defines them as written right here. These are deaths where the patient died within 60 days of testing positive. But there is also confusion over there, because sometimes they say within 60 days, but it also says includes deaths where patient died within 28 days. So we're really actually not sure whether it's 60 or 28. But what is very important, that on their official website, on the their website, where you remember we showed you this table from United Kingdom, they do have 2 separate tables. One table shows the COVID death within 28 days, and then within 60 days. So this becomes a very deterministic way of defining COVID death. So really, if a person has a positive COVID test, he will be added, his death will be added to this count. And you see there is one table A and one table B right here. So all these numbers, we know how these numbers were obtained based on the positive test result. Now in Canadian data, when we look here, you would see that actually they define it in a slightly different manner. And we can see how they define it. We go to this severe illnesses and outcomes page. This is where they show variation by age. And you would see in the text description, they don't call it COVID deaths, they call it distribution of COVID cases deceased. So there were COVID cases and they were deceased. So that's why we now are using this definition for Canadian data. So instead of saying COVID deaths, it could be probably more correct to say COVID cases deceased. And this is where you would see, again, the numbers of COVID cases deceased by age. And again, you see that the practically none young people who die, who are deceased with COVID case, right? So then I looked specifically into the definition of these COVID cases deceased in Canada. And it is posted right here. Actually, it is written on official Canada website. It's a probable or confirmed COVID case whose death resulted from clinically compatible illness, unless there is a clear alternative cause of death. For example, trauma, poisoning, drug overdose, and so on. And then it also says that a medical officer or coroner may use their own discretion when determining if a death was due to COVID or maybe due to something else. So in Canada, we see it's on the discretion of a medical officer, right? So because of that, we really cannot state whether the person died directly from COVID, with COVID, maybe it was a contributing factor. But again, just based on the fact that the average mortality rate for people who die of COVID is about the same as the expected life expectancy in Canada. So from here, we could kind of sense that indeed it's other problems, health problems, which are most important, most likely in the outcome of the COVID case. Okay, so we have answered that question, and if there are any other questions, again, you can ask them here on YouTube or Twitter. Now, you would see there is already ongoing discussion in Twitter about what they have reported in United Kingdom. Actually, just yesterday night, a colleague of mine from United Kingdom sent me a link to the YouTube and suggested to watch. It was very interesting to watch because it was shown on in UK. They call it mainstream video or video channel, and it was very interesting to see what they discuss in United Kingdom. So again, at this point, probably we will close the presentation and we could start the discussion.